Okay, thank you everybody for joining us today. If you are willing, please use the chat to just introduce who you are and what organization or affiliation that you have. Also, feel free to put comments or questions throughout the presentation in there, just in case we don't have a lot of time to do a back and forth conversation later on. My name is Salam Miscano, and I'm the founder of the Tesfa program, and I'm here with Rachel.
Hi, my name is Rachel Podosvensky, and I'm a senior project manager with the Tesfa program, and we're really excited to share some of these findings with you today.
Awesome. So Tesfa, the word Tesfa means hope in Amharic, which is one of the languages spoken in Ethiopia. And the focus of the program was, it started during March 2020. Because COVID information was changing really fast, a lot of times I was noticing that in my own family and church circles of people, that information wasn't always getting to folks in a timely manner, or sometimes it was just too confusing. A lot of time it was just in English. And so I started this program where it's just a conference call every Sunday in the afternoon, and people call in and we talk about the COVID pandemic, what kind of resources, what kind of mandates were out there, just like sharing information. And then over time, we got more and more volunteers, which is really great. And they can bring in their expertise. So we had, like, for example, lawyers who talked about how some of the immigration law was changing, or immigration policies were changing all the time. And so all of that was happening every Sunday, March 2020 to June 2021. And just to give you a little bit of context about the Ethiopian community, I think one thing I like to always say is just like, we really don't know the exact number of people who are born in Ethiopia or would classify themselves as Ethiopians. The way we collect data around race and ethnicity doesn't always capture that. And so we don't always know. But one of the things we do know in terms of rates is that Ethiopian-born residents of King County make up the largest East African group, and that Amharic as a language is one of the top 10 most spoken languages in the county, other than English. So that kind of gives you a sense of kind of the scale of the population we're talking about. So in terms of thinking about this particular COO project, it's really like, we wanted to do it because we realized that this volunteer-run program that was happening for COVID was really important and emergent. Like, we needed to respond, and we couldn't wait for like an agency or something to do it. Like, as volunteers, as individuals, we just needed to get together and do this conference call to help our community. But at the same time, we realized that this is not really sustainable in the long run, and that we also have started to observe kind of like the gaps in capacity of agencies, or just even the understanding of the community with agencies in order to effectively serve this population. So this sort of storytelling, collecting evidence and experience felt like the right next step for this project. Next slide. So in terms of, theory of change, or kind of what we believe what this project could do, the purpose of it is that we think that stories are really powerful. And so collecting it, documenting it, and then sharing it, around kind of what the experience of the Ethiopian immigrant community was during pandemic is going to lead to more visibility of the community, both in terms of its assets, the assets that we had, and the ways we stayed together and strong and support each other, but also ways that we experience challenges at an individual level and as a community level. So that's one piece of it. But the other is also thinking about, as program practitioners through this volunteer-run program, and what else we know about other East African groups, and sort of what practices work best with them. We thought that by collecting this information and sharing it with the appropriate audience, we can increase capacity of agencies so they can improve the way that they're delivering services to this community. And so overall, in the long run, our hope is that they'd be a positive change in health and well-being in our community. Next slide. And I talked a little bit about kind of the gap in data and stories. And so one of the biggest thing we did in our project is like really heavily invest in collecting data, as much data as we can, and especially doing it in different ways to make sure that we're not missing anything, or at least we're kind of like making sure that things are, the results that we're getting are not based on the tool, but they were corroborated, I guess you could say. And so, and we didn't do it alone. I think, like I said, we were mostly volunteers, so we really wanted to rely on more experienced researchers to help us like analyze the data that we have collected. So I talked earlier about the conference calls. All of those were recorded. And initially we were just recording to share it out with people who couldn't make it. But later on, we kind of realized like this is like a time capsule of like COVID conversations that were happening in our community over the last like 50 or some weeks or whatever, however many weeks there were between those times. So we worked with a group called Scope at the University of Washington. They have Amharic-speaking researchers, and that was really important because most of the data we had was in Amharic, so we needed researchers who can actually look at that. And so that was kind of how we went about data collection. Next slide. So our deliverable through this toolkit or CEO grant is a web-based toolkit. And so and one of the things we thought about is like thinking about audiences, like who are we speaking to when it comes to this. So we have all this data, we have all these things we learned through our program, we collected all these stories, but like how are we going to message it? When it comes to thinking about like evidence-based practices, we thought about 3 specific audiences: providers, organization, decision makers. Today, Rachel and I are only just going to talk about organizations and like some of the consideration organizations can make. But then, when the full toolkit comes out, it will include all the other audiences. Next slide. So one of the things that, at least personally, that it really stuck for me is the power of faith-based organizations in our community, in the Ethiopian community, and the leaders there who play a very critical role in the daily lives of Ethiopians. And when I say faith, I am not talking about one single religion, like with the 3 major religions: Orthodox Christianity, Islam, Protestantism. All those 3 are kind of the larger numbers or proportion of people in the diaspora, Ethiopians. That's kind of the faith that they follow. And even during the pandemic, the ties were still very strong. So they were still, providing services. They had to pivot like all other organizations when things got on lockdown, but they were providing they continued to provide a lot of services to the community, and they continued to be influential in how people thought about COVID. So the considerations, I think, with partners or with agencies or organizations for us is, how our organizations, whether it's like some kind of public health or a nonprofit, whether it's a social service or public health organization, how are these organizations thinking about partnering with faith-based organizations? Because I think being in Seattle, sometimes we don't have the same culture around thinking about religious spaces as an important community partner. It's sort of acknowledged in some sectors, but I feel like overall we're not taking advantage of this really large, very close network of people. And so this, I think one of the considerations thinking about building relationships with these groups, which are going to feel very differently than like if you're partnering with like a community center or a nonprofit, that provides like after school programs. But it's worth that investment just because of how deeply this community is embedded in their the religion. So that would be like one consideration that we thought through. And I'm excited for you guys. If you end up looking at our podcast, there'll be interviews and conversation with several faith leaders in the community. that will be, I think, very interesting insight into kind of like how they do work, how they thought about the pandemic, how they supported their community during that time. And so now I will let Rachel talk a little bit more about, communication and also targeted programming and how organizations can think through that as well.
Yeah, so another thing we wanted to highlight in our guide was talking about social media considerations and specifically around auto-translate. And by auto-translate, what I mean is when you post in when languages other than English, social media platforms may automatically translate the words back into English for users that either default to English or for users who have a primary language that's not listed as an option for the social media platform. So for example, if you post in Amharic, if you don't have the option to say that your primary language is Amharic, then it's going to automatically translate back into English, even though you could read the Amharic if the post were untouched. So our recommendation or thing to really consider is to turn off the auto-translate on your social media posts. And the other thing is to double check regularly that it is still turned off. And so I'm going to draw your attention to the screen for these examples coming up because I'm not going to read them out loud, but I want to share a couple of my favorite auto translates from the year. These are the highlights. Okay, next slide. Here is the first one. So these three are all about lead in workplace safety, as the title is probably pretty correct. Okay, let's go to the next one. Another one not translating back well. And then the third one, please. So just because people do consume technology and social media in multiple languages, and because you might be speaking in Amharic, but you might prefer to consume your social media in English, these are just one of the things that you need to think about because technology just isn't there yet in terms of auto-translate. We are making a lot of progress, but for now, that is our recommendation, and we highly recommend you consider it. So the next one I'd like to bring up is thinking about targeted marketing leading to distrust. And I think one of the things that's really important with this when we talk about targeted marketing is thinking about the COVID vaccine rollout in Washington and really trying to have an equitable approach. You wouldn't think I've said that a million times today. To reaching audiences that have traditionally had a harder time accessing medical care and the vaccine. So one of the examples we wanted to bring up where targeted marketing specifically unintentionally alienated the community was an example when we were having our regular Tesfa program weekly meeting and we were talking about a COVID-19 vaccination event that was specifically for people that self-identified as being Black or African American. And so, we were want people to take advantage of resources that are available. And then we got this question. Next slide, please. So why is this vaccine only for Black people? And so this is not to say that, that we shouldn't try to strive for equity or an equitable rollout of vaccination. But it's thinking about how our marketing and how our approach pays off. And so it's really just thinking about that consideration, especially in this context, given the history of medical testing on Black and African American communities in the US, but also thinking about specifically for the Ethiopian community where there's been medical traumas around vaccination in other countries as immigrants and also in country in Ethiopia. So just taking that into consideration will be something else we'll talk about in our toolkit. Next slide, please. So we're going to be discussing a lot of other topics in our toolkit. Next slide. But these are just a few. So, and some of these will also be covered during the podcast, but will be more in context, like the interviews with the religious figures, faith leaders that Salam interviewed with. And so we're going to be talking about misinformation, unemployment, and other things that came up using the evidence that was collected during this whole program. Next slide, please. So I just want to say to everybody that we're going to be having our Toolkit launch on a web-based platform in March of 2022 because we needed that time to make sure it was as beautiful as we wanted it to be. As part of it, before it launches, we're going to have an 8 podcast episode series. So those are going to be a series of interviews, and then we're also going to include, similar to the 3 tracks, we're going to be sharing those tangible and less tangible best practices and considerations for working with the Amharic-speaking community. And then we're also going to be sharing our data and also the research summaries of that information that has been produced by University of Washington Scope and also some of the other data that we've worked to put together because we're data nerds also. So I just want to open this up to questions, comments. We have at least, it sounds like 3 minutes. Okay.
Hi, some nights. Hi, Sweet May. The books that I know. Just want to say hello.
That was wonderful work. Thank you so much. I have a question. If you build it, right, they will come. If you build the toolkit, they will use it. That's actually a question. Like, how do you plan to get people to use this to their advantage? Some will gravitate toward it, but others, how will they know and how will they get it?
If it's okay, I'll address this one because Salam knows one of the reasons why I really wanted to work on this project with her is because many years ago when I was an AmeriCorps outreach member at Within Reach in King County and beyond, that I did direct outreach and I was looking for information on best practices. And I scoured the internet and could not find very many and had a wonderful session with a medical translator at Seattle Children's Hospital about some of the best practices for working with the community. And so we've been talking about doing this project for years. So in some ways, I'm going to take advantage of there's going to be at least a couple other Rachels, either in their AmeriCorps terms or after, that are going to be fascinated by the topic. But I'll say that I think we're trying to make this as interesting and as humanizing as possible. So that's why we didn't want to just do another boring, I mean, not that toolkits are boring, but like we're trying to do the podcast episodes. We hired a photographer. We're trying to make it really graphically interesting. And we're also trying to get to the point. It's not going to be long for each section. We're trying to keep it short, interesting, and then we're going to be focused more on doing some marketing once we actually start launching. And we're going to be doing more of a rolling launch. So in some ways, I do believe people will naturally kind of gravitate to that for those that are enthusiastic. But yeah, I do think that's going to be one of the things that's going to be a struggle, but we're hoping at least if we provide the resource in an interesting way, it'll kind of speak for itself. And also we're telling all of you right now, so you can help spread the word. And just so you know, we did just launch our podcast trailer. It's going to be on Apple Podcasts, or it's on Apple Podcasts, and it is 13 Months of Sunshine. And you'll be able to see it on the slides when they send it out. I put the link in the last one. But Salam is a budding podcaster and does all the interviews. And they're either in Amharic or translated in with English or in English. So, yes. We hope you'll listen to the stories and that will speak to you.
Anyone else have any questions or comments?
They're going to kick us out any moment. Thank you all for listening.